Thanks for taking a listen. This is a really fascinating case of a gentleman in his 60s who presented to my clinic with 1-year history of episodic wrist and MCP pain in his hands. The pain would come and go, waxing and waning, looking a lot like palindromic rheumatoid arthritis. He had negative serologies, but did have elevations consistently in his CRP over the course of the year. He came in with a new symptom of left-sided chest pain. The chest pain was worse with breathing and worse with laying on his side. He also had endorsed a history of tobacco use and 40-pound weight loss over the course of 6 months. So the concern here obviously was malignancy. A chest x-ray was ordered, which was unremarkable. Then we proceeded with a CT scan, which showed pleural thickening and pericardial thickening. The pleural thickening corresponded with the area of his pain. The CT also picked up the upper abdomen, which showed retroperitoneal lymphadenopathy. So to better characterize the lymphadenopathy, an MRI was ordered, which showed diffuse mesenteric lymphadenopathy, predominantly a fatty infiltrate, which is inconsistent with lymphoma. It also showed small bowel thickening. This is actually characteristic imaging findings of a certain disease. If you put that together with the waxing and waning inflammatory arthritis, the pericardial thickening, and the pleural thickening with the weight loss and diarrhea, this is actually characteristic of Whipple's disease. So how do we prove that? We prove that with an EGD and duodenal biopsy. The duodenal biopsy shown here shows thickening of the villi with the infiltrate of foamy macrophages. And then if you do PAS staining, as we do here, it looks like a pepperoni pizza, it's positive, which is consistent with Whipple's disease. So Whipple's disease is an incredible disease to pick up because it's completely curable with IV antibiotics. It takes a prolonged course, but this patient completely recovered. All of his symptoms, including the weight loss, completely recovered, and he's doing well. So it's a curable cause of inflammatory arthritis that can be life-saving if picked up. Thanks for listening.